Well, good afternoon. It's 12:30, give or take a few moments. And this is Dr. Ken Muich, Fibromyalgia Wellness Center. Welcome to Russia. Whoops, I'm sorry. After the commotion this morning with that special, um, meeting between our president and Putin, one wonders. Anyway, I'm here to talk to you about the Fibromyalgia Wellness Center and some case studies that I had just mentioned. And these are very, very interesting because they involve a lot of symptoms that many of you probably have, and also some concerns. So I thought I'd go over these with you. There's two of them I'd like to cover, and both of them are of a mature age. So that really kind of leads into something else I'm talking about, because we have fibromyalgia patients that are children all the way up to seniors, and many of them come in as seniors because they've tried just about everything else and nothing has really worked. The first one, short case history, is from Mrs. R.H. We can't use their names, but I thought I would at least let you know that they are human beings. She's a female. She came in when she was age 64 into our clinic on 9/15/16. Sorry, I have to every once in a while gauge and look at ages and so forth. And she was diagnosed recently at that time by a rheumatologist that she had fibromyalgia. She was a retired teacher with two children. And the symptoms that she had involved sleep apnea with a lot of sleep problems, inability to sleep throughout the night, also some pulmonary problems, and she had a back injury, pretty severe back injury in 2007. The interesting thing is that the fibromyalgia runs through the bloodline, which again is not uncommon. Two sisters of her, two daughters, and a grandchild all have and been diagnosed with fibromyalgia. Some of them are on our protocol, some are not because they're out of town. But anyway, those that are on our protocol are being helped. Now, she also has the symptoms of whole body pain, which is not uncommon for most fibromyalgia patients, and a great deal of fatigue because of this, of the problems that she's having, not only sleep apnea, but also pulmonary. The interesting thing is that she's only on one med, and that is baby aspirin, because her cardiologist has her on only one med. She took her off of all the other medications. It was too much of a strain for her. So what we did was, when patients usually come in, we do a thorough history, just like what I gave you, actually more intense than that. And we start, if the patient is diagnosed, and she was a perfect example of fibromyalgia. Even though patients come in that have been diagnosed, we still go through the whole protocol to make sure that the patient is a fibromyalgia patient. Some patients are misdiagnosed. Some patients are misdiagnosed because there's about 13 other diagnoses, as I mentioned to you, that mimic fibromyalgia, or fibromyalgia mimics them, either one you want to look at. But we start them on examination, orthopedic neurological examinations. We want to make sure that what the white smoke is, so to speak, what is actually happening as far as the patient is concerned, to differentiate other conditions from what she actually has. So we go through orthopedic neurological tests. We go through the primary symptoms of fibromyalgia, 18 specific points of tenderness. Not pain, but tenderness. That's what the definition actually is as far as the test is concerned. And we do mapping. We then started out the patient on our pre-protocol, which involved a very gentle liver kidney detox, and also omega-3. We also put her on conjugated linoleic acid for dissolving of some fat, magnesium and malic acid. All of those are either anti-inflammatories or for actual stimulation of the mitochondria, mitochondria produce ATP. For about 2 weeks. Within literally 11 days, she actually started feeling a little bit better. She had more energy, and that fibro fog, that stuff that you have a difficult time concentrating because of fatigue, actually started to abate a little bit, and she started feeling better. And we, after the pre-protocol, we actually placed her on 300 milligrams of guaifenesin. And within, again, and that was on at the beginning of the program. Within 2 weeks, she started again feeling better, but we had to increase the guaifenesin due to the testing to 600 milligrams. In the meantime, she had lost 5 pounds, which she was very, very happy about. And this continued where her improvement from 9, 15, 16 improved over the actual month or so, where she started feeling very good. Matter of fact, in the middle of October, she came in and she said over the last 3 days she had slept 6 hours, 7 hours, and 8 hours. She had not done that in decades. Because of her sleep apnea and the problems that she was having overall health-wise. So we were very, very happy about that. In November, she snuck out of town. She didn't even tell us. She was feeling so good, she snuck out of town, went to Hawaii with her family on vacation. I'm sorry to say, however, during her vacation, she slipped and fell on her knees and injured her knees and her back. Now, I want to stop here for a moment and explain to you that when a fibromyalgia patient comes in with a trauma, or during treatment they have a trauma, it takes anywhere from 3 to 5 or 6 times longer for a patient to heal because of the lack of energy in the mitochondria that are trying to take care of the body. This is very, very difficult for insurance companies to understand, especially if there's an auto accident involved. Most auto accidents we take care of, follow a certain ritual and a following schedule. But for fibromyalgia patients, it's up and down. It's up and down and up and down because of the lack of ATP production, shall we say, that is very, very important for your healing. So this patient took a lot longer to get through this because what now we were dealing with was an accident along with her fibromyalgia and her other health problems. But she did slowly continue to improve, and she was very, very happy about that. In the meantime, I wasn't seeing her that much. I was actually seeing her maybe once every month or two, as a matter of fact, because the fibro was doing well, and she was being treated for her injuries elsewhere. And so consequently, it took longer. However, almost 1 year to the day. In September she began. In 2016 and 2017 she came in and she was completely 100% pain-free of everything, not only her accident but also all fibromyalgia symptoms. Matter of fact, we did orthopedic neurological tests, evaluation, so forth and so on, and everything turned out negative for her. And so we released her on a continuation of the guaifenesin protocol of 600 milligrams twice a day, and that's something you have to take to make sure it evacuates all of the excess phosphate and calcium and keeps it that way. Some patients cheat. I mean, they maybe don't take it as much or as often, but as soon as the symptoms start to return, they get back to exactly what they had taken. So we're very, very happy. We see this patient, Mrs. RH, maybe, excuse me, once a quarter, once every 3-4 months now, and we just check to make sure she's still at the same level that she was, and so we're very, very happy about that. So looks like we got a number of people that are coming into our presentation, which is great. Hello, everybody. Now the second person is also a mature individual. It's a male, age 74, and he came into our clinic on 8/9/17. He's very, very interesting history. He stated that he was undiagnosed, really. This is not a person that was diagnosed at all. He came in, he was talking about how his problems actually started at the age of 14, where he had severe fatigue, and that it really seemed to bother him. He was not able to join in all of his classmates and so forth, and a lot of activities. It was a real strain for him. He kept on going to his doctor, and his doctor kept on telling him that it was growing pains. And so he never had been really diagnosed properly. But we put him through the same thing, orthopedic neurological tests, the primary symptoms of fibromyalgia, 18 points. We put him through mapping, did everything, and the diagnosis actually led to fibromyalgia and CFS, chronic fatigue syndrome, that he had. So this is one that's very, very close. As anybody recalls, if they've been listening to my live videos, almost all fibromyalgia patients have some form of chronic fatigue However, not all chronic fatigue patients have fibromyalgia. Matter of fact, they swear and everything else. I don't have it. I don't want it. I don't need it. And many of them don't have chronic fatigue. Thank goodness. Okay, but many do have some form of chronic fatigue syndrome. So it's very, very frustrating for them to have both of these, because one of the aspects of fibromyalgia, very, very important, is fatigue, heavy levels of fatigue, because they, again, mitochondria, those little ever-ready batteries in your body, and each cell, trillions and trillions of them, produce ATP, which is the energy that does everything for your body. Everything from your skin to your organs to me being able to talk and blink and make all sorts of reactions and so forth. You're able to walk, run, so forth. That's all adenosine triphosphate. And for fibromyalgia patients, especially chronic fatigue, it really adversely affects them. So we started him since, a lot of the other symptoms that he had, by the way, irritable bowel, a lot of intestinal problems. He was losing weight because he couldn't eat properly. He had leg cramps. He was dizzy. He had gas, nauseousness. He had overall body pain. Really, the same things that many of the fibromyalgia patients have. And so the diagnosis, although we don't assume anything, we make sure that we check everything, turned out to be, I think, correct based upon his treatment. So he didn't go through pre-protocol because of his intestinal problems. We didn't place him on a pre-protocol because he was already on a restricted diet, so to speak, for quite a while, because he couldn't eat so many different things. So rather than forcing him into a pre-protocol that he really didn't need, we actually placed him directly on the guaifenesin protocol. We started him out originally, even though he came in on 8/9/17. He told us at that time that he was going on a little vacation, so he didn't want to start anything until he came back. So we actually started on this protocol on 8/25/17. We started him at 300 milligrams twice a day of guaifenesin. That's the basic amount that we start with. And almost immediately, he started having increases in less fatigue, in less leg pain, in less intestinal problems, so forth and so on. And this continued to improve. His symptoms kept on reducing, and by 11/21/17, they had improved appreciably to the point where we actually reevaluated and we changed. Because of certain things we found, we changed his guaifenesin to 600 milligrams, just kind of up the period of time. He did go through some waxing and waning as far as the fatigue is concerned. He'd have good days, and then all of a sudden he'd have bad days, and the good days, and then bad days. Again, this is the chronic fatigue. We were helping him with the fibromyalgia aspect of it, but still, it takes a little time for patients to get stabilized and really get that level amount of treatment, so to speak, so you don't have so many ups and downs. By February, now that's about 4 months, actually less than 4 months, he had improved to the point where he was 97% cleared of everything. All of his orthopedic neurological tests and mapping were almost 100% clear. And so what we put him on is an as-needed basis. We now are seeing him as needed basis, except if he has any other any treatment capabilities or any other problems that he may have spinal-wise. So again, he's on 600 milligrams twice a day, and that's a very, very wonderful success story. Literally, actually, I think it's a little bit less than 6 months, if I recall. Most patients, believe it or not, get finished with our protocol within 3 to 6 months. Depending upon the secondary problems that they have. Now, this gentleman had some really severe chronic fatigue, but our protocol still helped, and I'm sure it does for all of our patients that go through it that stay on it, and that's the most important thing. So we're very, very happy for these. I could cover other individuals for other patients that have gone through this. I have one really exciting young lady that came in and has problems, but maybe we'll save that for another day. But I thought I would show you what our protocol entails and how it helps patients. Now, the one actually took almost a year. But the reason why was that she had secondary things that occurred as she started the program, and that was that fall that she had. But she was good enough, like I say, she said she was feeling great until she fell, and then she had a relapse, so to speak, and it took a while for her to get better. As we mature, it takes injuries and accidents longer, obviously, but we try to help it along as much as we can. One side aspect of it is that if we find any treatments that we could do in a clinic to get rid of those secondary symptoms like osteoarthritis and so forth, we do chiropractic manipulation, physiotherapy, and gentle treatment exercises and so forth to help the patient improve even faster during this period of time. So I want to thank everybody that participated. If you've missed this or missed part of it, we're going to put it on save so that we can put this on our website so you can check this later. Lots of health, love, and blessings to each and every one of you. Next Monday at 12:30, I'll be covering another subject on fibromyalgia that hopefully will help you understand what we do. In the meantime, October 6th and 7th, we'll be training doctors on our protocol in Scottsdale, Arizona. At the Franciscan Renewal Center for 2 days, October 6th and 7th. It's 12 hours with certified educational units that physicians need. And so if you know someone that your doctor, say, for example, that does not have an understanding of fibromyalgia and how it is treated properly, please have them come out and check the Fibro Wellness Center for details. Anyway, thank you very, very much. And I look forward to seeing each of you next week on Monday, 12:30. Have a wonderful week now, okay? Enjoy. I usually wear a tie, but when it gets to be 110, I usually take it off. It's a little bit easier to work with, that's for sure. Everybody have a wonderful day and a great week. Bye-bye now.